Hi friends, now I will be telling you about allopathic treatment, especially the drug reactions in allopathy and how to be safe. Please note that this video is made under the guidance of a much senior allopathic doctor. The sources of infections are many, mainly due to poor hygiene, and some patients react not only to specific drugs but also react to particular type of food stuff, environment, scents, odors, drinks, eatables, oils, meats, milk and milk products, poultry and seafoods like the seaweed also, and even colors, chemicals, persons, situations, etc. When you visit a doctor for treatment, he or she can only see your visible or noticeable symptoms or what she or he can find out using a stethoscope. What is about your heart and your lungs? What is wrong in them? Not all the other things that had happened to you or what you had encountered before coming to the doctor. So let us not blame the doctors if a patient has any side effects after or during a treatment or just after starting a treatment, because the things which the person had faced or encountered before or had eaten before coming to the doctor can react with the medicines what the doctor gives later. Some doctors will succumb to the patient's demands of giving a high dose of a medicine to recover quickly. The doctor will say, okay, I'll give you a high dose if you want to become all right soon and go somewhere or do something. But some doctors will never listen to the patient's demands and will stick to their own way of thinking and will tell the patient to only follow his prescription or her prescription and not to increase any dose or something like that to get quick results. A patient can even ask over the counter medicines at the pharmacy, and the pharmacists give them mostly without a doctor's prescription. So, mostly the pharmacists advise to take low doses, lower than what a doctor would have given. But the patients take double the dose each time to become all right fast according to their way of thinking. They think if they take double the dose, they will get cured instead of 4 days, they'll get cured in 2 days, like that. This can create a great risk to the health of the patient. If the patient was given 200 milligram plus 200 milligram plus 200 milligram morning, afternoon, night, say only 3 times a day by the doctor or the pharmacist for a day after meals, the patient will take 400 milligram each time, which becomes 1200 milligram for the full day. It is very risky because more than 1000 milligram of any antibiotic per day is dangerous for any person. Then, if any side effects occur, the person or the patient will blame the doctor who had given the medicine, or at least will blame the pharmacist who had given the medicine without a prescription. He can't be found guilty for that because the pharmacist doesn't have or has not given any proof that he had given the medicine, but the doctor had given a prescription, so that is a proof that the doctor had given the medicine. But the patient misused the information given by the doctor and took the double the dose may never be revealed by the patient, but the doctor can be blamed for it. Friends, remember that high doses of antibiotics makes our immunity weak, our body's natural defense mechanism to fight any diseases. So when taking antibiotics, we must take a tonic or a multivitamin tablet like Zincovit or Dexorange syrup or Chyawanprash as written on the pack. I say Zincovit because zinc helps to increase immunity. That's why I told about the multivitamin Zincovit here. Hence, always start the treatment to be safe with the minimum dose and gradually increase the dose if the low dose does not work. For example, 200 milligram plus 200 milligram is given to you, say for the treatment in the beginning, afternoon and night. Take that first. If it is not working in 2 days, then you can take 400 milligram plus 400 milligram, because it is totally 800 milligram per day and not more than 1000 milligram, because more than that is dangerous, as I told before. Last, you can take 500 milligram plus 500 milligram, that is total 1000 milligram. That is the safest if you are not becoming all right only, or if your sickness is too strong or too bad. Or you can break that down into 250 milligram and 250 milligram, or 250 milligram 4 times a day. Again, it comes up to 1000 milligram per day, which is in the safe range. But it has to be accompanied by a tonic or a multivitamin, as I said before, and you will become all right. A multivitamin is required because when you take antibiotics, our body becomes weaker to gain strength. And also, your food, even if you are very sick and you can't have solid food and all, just you have light foods or mashed foods, but eat food. Don't just stay on medicines. You can take an allopathic tonic or an ayurvedic chavanprash, no, both together, allopathic tonic and ayurvedic chavanprash together for 3 months in the beginning. If you feel very weak, that will not give you any side effects or overdosage. Later you can continue with the chavanprash every day, or take the allopathic tonic with a gap of 2 months for 1 month, to avoid overdose of nutrients in your bodies. Remember, once a higher dose is given, lower doses given afterwards will not have any effect. They will not work. Give nature and your body immunity enough time to help the prescribed medicine to act on the sickness and for you to recover. Don't expect fast results. Meaning, complete the prescribed course of treatment to see results. And as I said, don't expect fast results or good results on the second day itself of the treatment. You will surely recover in if you complete the course of the treatment as prescribed by the doctor, those number of days. You have to be patient. Slowly you will recover, because antibiotics cannot kill the germ which is in your body directly on in 1 day. Slowly it will get killed, and when it is completely killed, the main thing is, if you are due to infection, if you are getting fever, your fever will go down little, and then 1 day you will stop getting fever completely. That means your infection is cured and you have recovered now. There is no more infection or no more germs in your bodies. Also, avoid getting sick first. For example, if it is raining, don't get wet in the rain and come home. If you don't have an umbrella or raincoat, wait till the rain goes or stops. If you got wet suddenly on the way, or when you were driving or riding, or even when you were walking, suddenly it rained and you became wet, come home and have a hot bath to avoid catching a cold, rather than catching a cold and then treating it. If not treated soon, and if the person neglects the symptoms of cold, the cold can develop into a severe condition, because the cold itself will continue and make the person weaker and weaker. The immunity will go down because the person is not taking any precautions to fight the cold, and also is not taking any immunity boosting tonic or nothing. Even food should be very nutritious this time. So when the body immunity is weak, that time body can be infected soon. And if at that time a bacterial infection occurs in the person due to low immunity, even pneumonia can occur. And still, if the person ignores the condition and continues doing his daily work like that only with a cold and pneumonia. He may not even know that he has pneumonia. In such a case, even finally a person can die. So, friends, for any disease, later it is difficult to cure. If you come to know about any sickness, even the starting of a cold will be your nose will start tickling. So you know that you are going to get a cold. At that moment, if you just take anything, even a piece of ginger, if you have, or even a syrup of sugar and onion kept overnight, anything, even a simple thing, a chest on cold, just a small tablet, the minimum dose, you will just avoid the cold completely without when it just started, and it is very easy to cure instead of taking a long treatment later on. So friends, if you like my explanation about the topic which uh, this topic, that is drug reactions in allopathy and how we can be safe, do like, comment, and tell me how you liked it, what you felt about it. Take care and subscribe, share it with your friends. Let them also know how they can be safe with allopathic medicines and how they can prevent getting very sick. Take care and lots of love to you all. Bye.